I would firmly defend the principle that if we're going to focus on total lives saved and lost, we should look at deaths not just due to say the spread of COVID-19, but also that due to social and psychological and workplace factors as well. I mean, there's evidence that sort of loss of employment is associated with maybe 50-70% higher mortality, the loss of social support or experiencing depression, maybe a 30% higher mortality rate. And so, policy decisions around the pandemic certainly affected not just the spread of COVID-19, which again, I think was critical and essential and needs to be taken into account, but also affected mental health, affected social relationships. So again, maybe not as substantially as we might have thought initially, and for a time at least, severely affected employment. So I do think these other outcomes should be taken into account, both for their own sake, but even if the focus is going to be kind of on a total lives saved approach. Now, how to do this in practice, I think, is a challenging matter. Often you don't know, the consequences of policy decisions in advance. As has also been clear, we haven't known the dynamics of COVID-19 in advance. When was the vaccine going to be ready? What were its effects going to be? What was going to happen to the variants? I think there have been a lot of surprises. So it's not as though the flourishing lens kind of solves all of our difficulties in decision making. I just think it introduces a broader set of important outcomes that people care about, that should be seriously taken into account, both for their own sake and also for their effects on mortality itself.